All right, so today we have 37 people. We should have about 45 in total, but if you're ready, we can get the ball rolling now.
Yeah, I have one quick question. Are we going to use the approach of the breakout room for people to sign their questions or not?
No, I don't think so. Not today, because we have a pretty small number, smaller than we were anticipating.
All right. So I'm just getting to the ground rules that I'm supposed to read in the beginning. So we'll do the ones without the breakout room. Perfect. I'm ready to go.
Wonderful. We're all ready here as well.
So I want to welcome everybody. This is Assemblymember Harry Bronson. I represent the 138th Assembly District and the Rochester School for the Deaf, which is my great honor. Great partners with the Rochester School for the Deaf, including Superintendent Anthony McLetchie, and also great partners with the association that represents 4201 schools, which the School for the Deaf is, as well as other special needs schools across the state. For those listening in, I welcome parents of students, the students themselves, and some teachers are in the conference call, I understand. Welcome to all of you. And, you know, we get things done when we work with each other. So that means we need, you know, the superintendent, we need the teachers, we need the school administrators, we need the parents, and we need the children. Together, we work to make sure that our students are getting the very best education they possibly can. And I know that happens at the Rochester School for the Deaf. We're going to talk about a lot of things today, a little bit about COVID-19, how that impacts the school district, some of the legislation that we have been working on and passed that will help all of our families throughout our community. And, you know, but I want to start by just saying a few words and then I'll get to some ground rules. You know, these are challenging times and, you know, they're scary. They're scary for mom and dad and for all of our families. They're scary for our young children. It's scary because we don't know what's going to come next and we are struggling through this together. You know, some of the parents who are on this call may be laid off right now and collecting unemployment insurance. Others still be working, but they're working remotely, meaning they're in the home doing their work and also helping their children learn through distant learning. Some folks may be suffering with actual health issues related to COVID-19. If you don't take anything from this meeting but this one thing, I want you all to know that we're in this together. As a community, we'll get through this together by supporting each other, by caring for each other. And I think, and I truly believe, and I'm confident actually, that we'll get through this together and we'll be stronger for it. You know, some of the best learning experiences we have are also the most trying and difficult experiences we have. And this indeed is probably some of the most trying and difficult that most of us have gone through in our lives. So I just wanted to open with that. So I also want to share that, you know, I want this to be a communication back and forth. So to the extent people have questions, make sure that you put those questions in the comment section. We have a number that have come already in advance because we, Rochester School for the Deaf did a great job in advertising this on social media, and that's why we have so many people joining us. But I've been asked to give some ground rules, which is always good when we're in a large group meeting, and here social distancing is kind of a little bit different meeting because we can't see each other, see our body language, see our sign language, and so it makes it a little bit more difficult, but we'll get through that. But here are the ground rules. All participants have been muted. that's why you're only hearing from me right now. And your video is turned off. If you wish to pose a question for the Q&A portion, please feel free to enter the question in the chat box at any time. The questions will be read to us during the question and answer session. That'll be at the end of the program. And thank you all for participating. I also want to thank Samantha Marathu, who is with the Rochester School for the Deaf, and she's going to be serving as our moderator. Only Samantha and her team will be able to see the questions posed via chat in the chat room, and she'll read those questions or let us know what those questions are during the Q&A. Like every meeting, this is a Zoom meeting, but every meeting that we have, let's practice and maintain civility. And in any engagement in abusive or vulgar or inappropriate language or content will be, the person will be immediately removed from the session and will not be readmitted. I know none of you are going to do that. So we're in a good place, but just remember that we need to be civil with each other. So as I mentioned, these have been very trying times, and a lot of stuff has been going on. I want to say, the Governor Andrew Cuomo has done, I think, a really good job of sharing what a lot of us are feeling and experiencing, and then at the same time being pretty steadfast with solid leadership that is driven by science and our medicine. And that has allowed us to get through this and move through the pandemic in a way that I think has been successful, very difficult and trying, but we still have been able to do the best we can in one of the most difficult times. So the governor, as everybody knows, we'll call it the New York pause. That's where we were ordered to practice social distancing. Businesses were closed down. Some businesses were allowed to operate remotely, very similar to the way your school is operating with distance learning. And so that has created challenges, but we needed to do that so that people weren't close together and spreading the virus. And the governor's orders have initially was a complete New York pause with the exception of essential services being healthcare providers and the like. And those folks, we really need to step back and thank those folks because they continue to provide healthcare for all of our family members. And it's sometimes at their own personal risk. But we honor their work, and all of us then practicing social distances. So, the general rules, you've heard this over and over again over the last slightly over 2 months, and that is, wash your hands often, washing them for 20 seconds or more to make sure that you're cleansing them thoroughly. Practicing social distances, so staying 6 feet apart to the extent possible, and also wearing facial coverings that are snug and will prevent the spread of the virus from you to another person, but also the spread of the virus to you. So all of those things are common threads throughout, whether you're in the school setting, whether you're going out to grocery shop and things of those things that you have to do. So the original pause required schools to teach remotely. I am going to love to hear from the parents and the teachers and from the superintendent about how that all has played out with the RSD. But before we get to that, let's jump forward, if you will. And the governor just issued Executive Order 202.37. And the superintendent's probably gone through this much better than I have. So correct me if I make any mistakes here. But this is an executive order that is saying that we're going to be able to do summer school for children with special needs. And that would include 4201 schools, and that would include RSD. So there's some guidelines that the governor has set forth in connection with that. And this was just issued last week. I think it was June 5th, it was issued. And I'm just going to read it so that you understand what it says. So the order says, notwithstanding any prior executive order to the contrary, special education services and instruction required under federal, state, and local laws, rules, or regulations may be provided in person for the summer term in school districts. Any district providing such services in person must follow state and federal guidelines. So again, that would include RSD. And there's some guidelines that the governor, through consultation with the Department of Health and the Department of Education at the state level, and fully adhering to the federal guidelines, have set forth some of the things that you need to do when we're doing in-person summer schooling. That means, you got to continue to take the precautions that are necessary to reduce or prevent the spread of the virus. And again, that's all driven by public health information that we get from the Department of Health here at the state as well as at the federal level. So before you open, there's things that you have to do. You got to make sure that you talk and have communications with the parents and the guardians of the students. Superintendent, I hope that you're getting ready to do that if you haven't already started. And you have to talk about what it's going to be like when the student actually reports in person to the school for instructional programs. And so the other part is to make preparations to make sure that staff members and others have protective gear available to them that they can use, that they understand the needs to practice social distancing to the extent they can, and it's not driven and required by the educational program. Posting signs about ways to prevent the spread of the virus. The same things I just mentioned: washing hands, social distancing, being 6 feet apart, I mean by that phrase, and wearing facial coverings. And to train faculty and staff about those precautions, and also to look for signs if someone might be ill. Once opening, then it's all the stuff only is put in action. So make sure that the staff understands how to practice healthy hygiene, make sure that they're wearing their facial coverings, make sure that they are 6 feet apart from each other, staff to staff, as well as 6 feet apart from staff to student, again, unless the instructional need requires something different, and then you could be closer. Facial coverings, I think I understood this correctly. You can have alternatives to facial coverings with face shields and things of that nature. But the other thing, and in particular for RSD, facial coverings that could have a plastic transparent section of the facial covering, so that those individuals who read lips will be able to do that. And maybe the superintendent can chime in on those kind of things. So I've talked a lot about that. I'm also supposed to cover recent bills that we passed. I'm going to take, I'm not sure. I mean, I have a lot to say about the recent bills and things of that nature. But with your permission, Anthony and Samantha, you two put this together. Do we want to take questions a little bit about the opening for summer session first before I get into some of the things we did specifically related to health and housing and things of that nature for COVID-19?
Okay, I think it's important for us to have that response for the summer school programming first before we move on to that. First, Assemblyman, thank you for hosting this meeting with us. It's been great working with you. Also, I wanted to recognize Harry's strong advocacy for not only RSD, but for all 4201 schools. Some of you may be aware the 4201 School Association is an association of 10 different schools that provide low incidence students with education. For example, deaf students, physically disabled students, blind students, and severely disabled students fall under that category. So they really have their own boards and financial support from the State of New York Department of Education. Really, Harry has been very supportive to make sure that our school receives full access to funding, especially our funding needs, and access to our students, making sure that they have a high quality of education going forward. Harry also is a key player in receiving funding for our new boilers here at RSD. So I want to thank Harry for his advocacy work regarding that project. We are currently in the trenches working on that project now. So thank you very much. So now, speaking of summer school, we did receive the message from the governor last week, Friday, regarding summer session, and made an assessment of that and whether or not we'd be able to provide a safe environment in a short period of time. We've already started collecting information for fall reopening, and then all of a sudden, summer school is able to be open. So that kind of threw us into a bit of a tizzy. My job right now is really to make sure that we have a safe, well thought out plan in place in accordance with the Department of Health's criterion. And we are very much on the fence right now whether we'd be able to provide a safe environment this summer at RSD in person. So that's something we're now reviewing, the Department of Health requirements, and we will be continuing to provide distance learning while we are reviewing that information so that we're able to set up various places that we can comply with those requirements. So that's really our plan for summer school this year, is to remain with that distance learning. I know it is still a challenge. Some parents feel a bit anxious and a little trepidation regarding that. There's some uncertainty about this situation regarding summer school. So I think that's really our best answer regarding summer school. So I'll turn things back over to you, Assemblyman Bronson.
Thank you, Superintendent, for filling us in on where you're at. And thank you also for explaining about the association so that parents and students have a better idea of how the advocacy really works. And that association does a great job of helping me understand what are the needs of RSD and the other schools across the state. So thank you for that. Another example of the way we partner with each other and the way we really advocate and work for all of the students who go to RSD is to, what you had just mentioned of your evaluating and working your way through a potential fall opening or with the summer. So what I would do in front of all 37 people who are here is say, if you need me to help out with getting answers from the state education department or the governor's office, that you have questions and you need answers on what you really need to do as a school on behalf of the students, I'm certainly willing to do that. So that's an example of how we work in partnership with each other.
Yeah, I am in total agreement. our program is, it's very different from a lot of other public schools. We're very small. And so, we really have to evaluate what works best for us and what is going to be best to meet our needs. How we're going to advocate for buildings, how we're going to get a safety plan in place, how we're going to be able to provide, education, on an ongoing basis at the school. So that's why we're starting to collect up all the information on this reopening, or the potential reopening. The New York State Department of Education has set up a task force, that's focusing on all the opening for different regions. So one of those, I'll be representing our school there within that region. So it gives us an opportunity to, to work with the public schools, to have all the parents there together, to see us how we're working, how we're going to move forward. The Department of Education has distributed their IE. I'm sorry, I can't see. Hunter, can you see?
Guidelines, and those have been set up.
And those for the reopening, as I started to mention, we're talking with the people from the CDC, the Department of Health, trying to collect information so that we, will have, a great system in place. So that a place for teachers to be in a safe place, for our students to be in a safe place, for all of our staff to be safe. So Harry, back to you.
Yeah, thank you. And that's really what it's all about. It's to make sure that our children are safe, our students are safe, and that they're getting the best education they can. And I'm very confident RSD will take the steps necessary to make sure that we're getting the education and we're doing it in a healthy and safe way. So my next task, before we get to talk to a parent and a student, is to talk a little bit about what state legislation have we done in response to COVID-19. We are holding legislation session. That's when we pass laws. We're holding that remotely, just like you're all having remote learning. And so last week we passed a number of bills, but I also want to mention a bill that I just introduced this week. A group of folks came to me and asked me to introduce legislation that would require American Sign Language qualified interpreters to be included in live broadcast press conferences by the governor and by chief county executives during a declared state of emergency or local state of emergency. Some of you may have seen on the news, in the media, there was a lot of controversy because the governor in the beginning was not using sign interpreters in his daily press conferences, informing all of the residents of the state about decisions that were being made, his executive orders, the one I just covered. And so ultimately he did include American Sign Language interpretation. And but what I've been asked by some advocates for deaf individuals was to make this a law. So it's just not, I mean, he voluntarily did, actually he was sued and then he did it, but to make this a law. So I just introduced that bill because having information readily available in real time, especially in a time of an emergency, is essential. And we want to make sure everyone, no matter who they are getting that information. So I'm really happy that I've introduced that bill, and we'll try to get that passed when we go back into session again. let's put this all in context. So COVID-19, you're living it, you understand it from your own family's perspective and your own family's experience. As of June 10th, I don't have the numbers today, but this is what has happened here in Monroe County. We lost 247 people to COVID. We've had 3,176 confirmed cases of COVID. Our unemployment rate, many of the parents on this call perhaps are unemployed right now, went from a 3.7% unemployment to in April 15% unemployment. Statewide, we've had just under 2 million New Yorkers who are receiving unemployment insurance benefits. My office has been helping people marshal their way through getting those benefits. If there's anybody on the call right now who's having problems with unemployment or other, accessing health care, anything that you think that I can be helpful, I'm going to give out a number, and I would ask Samantha actually to put this in the chat if you would, but my office phone number is 585-244-5255. 585-244-5255. Or you can email me at my last name, Bronson, Bronson, H as in Harry, at nyassembly.gov. So reach out to us if you need help. Remember, I told you in the beginning, we're going to get through this by helping and supporting each other. And if the families need any help at all, go ahead and reach out to us. So some of the bills that we just passed, first we did 2 resolutions. That's where resolutions are things that you pass, and it's a statement of support, or it's a recognition of a day. In COVID-19, we did 2. One was to honor all of those healthcare workers and first responders and others who are on the front lines. Also people who are doing essential services that might not be in the health industry, that are on the front lines, and for them to continue to do their work so that we can get the services that we need as people who live in New York State. So we honored those folks. And then we did a resolution expressing our heartfelt condolences to all of the New Yorkers, including the ones who passed away here in Monroe County. So those were statements of support and community that I think we all feel, but we passed that as an official item when we were in session last week. A couple of things that we did, anti-pricing gouging. So, sometimes we have these emergencies and stores increase the cost of things. So we added, which was not in the list prior, medical supplies, and that would include facial coverings and other things, but all medical supplies are now, retail stores are prohibited from gouging and increasing those prices. We want employees who are in the healthcare industry to report if their employer is not following the safety measures that are necessary to keep everybody healthy. So we passed a law that said if an employee reports that, then the employer is not able to retaliate against that person for reporting that to the Department of Health or other officials. We are going through another crisis right now with the recent killing of George Floyd at the hands of law enforcement, which raises again the systemic racism that exists in our country and in New York State as well. There's this archaic law that prohibit the wearing of costumes or masks in public. Now, you would understand where that law came from. You don't want somebody wearing a mask going into a bank and then robbing the bank. That's what that really came from. But this law, we found out, was being used to arrest people of color on the streets. So we repealed that law recognizing that in this pandemic, people of color were being targeted when they were wearing masks on the street, where, you know, folks who look like me were not being targeted. So that was another law we passed. Then we did a series of laws, and I'm not going to get into all of them, but I just want to point out that if you're a renter out there, we have offered it's called the Emergency Rent Relief Act of 2020. I was a co-sponsor of the bill. That will provide funding to help with rental payments during the pandemic. So if you're in that situation, let me know and we can get you connected. There's a prohibition on evictions if a person is renting and they're not able to make those rental payments. Right now, during the pandemic, the landlord is not able to evict you. Now, that doesn't mean that you don't have to pay the rent. You will have to pay the rent, but you're not going to be kicked out on the streets during the pandemic, recognizing so many people are going through financial hardships. We also instituted a measure. So if you're a homeowner, you own your home, you have a mortgage, to delay the payment on those mortgages if you have a financial hardship for 180 days. Now, again, you're going to have to pay eventually, but you can spread that forbearance of mortgage payments. You can put that at the end of the mortgage and extend it for another 6 months, or you could spread out the payment of those monthly payments. You can spread that over the rest of the mortgage and just pay a higher amount each month. Now, there's a catch here, and this is an important caveat. We only have authority to do that and require banks to do that if they are a bank organized under the laws of New York. Most banks are organized under federal laws. So I'm asking Congressman Morelli in this area, our two senators, Senator Schumer and Gillibrand, if they'll try to do the same thing for federally organized banks. So that will help some families, but not all families. So we went through a number of things that helped families in that way. Some of the things to help small businesses. We've authorized the industrial development agencies. There's one in almost all counties throughout New York State that they can actually provide small dollar amount business loans to small businesses who didn't qualify under the federal program to help small businesses. And then we also did some stuff to think about how do we address the health issues as well. So, number one, I just mentioned the facial coverings and how people of color were disproportionately being stopped because they were wearing facial masks. We know that already under our health system, there's a disparity in health services and results for people of color. The COVID-19 has just increased that. I'm sure you've seen Mayor Lovely Warren on the news, County Executive Adam Bello. They all have talked about this. The head of our Department of Health, Dr. Mendoza, we at the state have decided we want to have a study done to really investigate the health impacts on people of color as it relates to COVID-19. A big, very important bill I was pleased to co-sponsor as well. We have already, because we want to make sure that once we have a vaccination that is tested and approved, that we make that accessible to individuals. So number one, we've required that vaccination to be covered by commercial health insurance companies. And two, we have said, similar to the flu vaccination, that pharmacists will be able to administer that vaccine. So once it's approved, again, we don't have one that's approved. Hopefully it will come sooner rather than later, but this really takes time. But once it's approved, that we will have pharmacists allowed to give vaccinations. And now just another bill, telemedicine. We've expanded the ability for individuals to get telemedicine so that you can use your cell phones and your computer and stuff to get consultation from healthcare providers. And then lastly, nursing homes is a big deal, and unfortunately lost far too many lives in our nursing homes because of the congregate setting that they're all together. So we passed legislation that will require, starting this year, that nursing homes and other residential care facilities are required to put together a plan of action for outbreaks of pandemics or other types of emergencies, and to present that plan of action to the Department of Health for approval. So that's just a small grouping of the legislation that we've already done. And I know that we need to move forward. We'll take some, if people have questions, please put those in the comment section about that legislation. I can follow up. But right now, I think I'm going to turn it back over to the superintendent, who is going to introduce a parent and a student for us.
Okay, thank you very much, Harry. So before I introduce them, the student and parents, first I'd like to, in the chat box, we have a phone number and we also have an email address. If you click on the chat logo, you'll be able to document those on your end. I also want to thank Harry for your support in making sure, information from this pandemic is accessible for deaf and hard of hearing individuals, and making sure that we have qualified interpreters on TV for those press briefings. Historically, we have not had those, so I'm hoping that that will apply to our local government and state government as well, to make sure that all of that information that's being presented during these emergency situations provide those qualified interpreters. So thank you for supporting that bill and making sure that it is equal for all, equal access for all. All right. So I have the pleasure of having a student representative and his parent here, who is actually a Parent Staff Association president here. We have the Canes here, Michael Kane, and they're going to share about their experience so far with the distance learning that we've been experiencing for the past 12 weeks. It has been a challenge for all of us. However, I think it is important for us to listen to the student and parent perspective as to what they've been experiencing. So I will hand it over to you two. Wonderful. Okay, hello. My name is Mike Kane, and I'm the current president of the FSA, or the Family and Student Association. Give me a second here. All right. I'm also a parent of two children. One is in high school and one is in middle school in 7th grade. And I also want to mention 3 other members of the PSA board are watching this broadcast as well. So, and they are also involved in the school as well as the outside community. So I am a teacher myself, and I'm going through this pandemic with the distance learning, and it's definitely been a challenge working and teaching and monitoring our children with not only regard to their academic progress, but otherwise. And we will become stronger for this experience. I'm going to turn this over to Emma, my daughter, who's going to talk about her experience of distance learning. Hello, so I'm going to introduce myself again. I am Emma Kane. I'm going to be a sophomore this fall, so I have had this experience has been completely different than what I've experienced in school. And it's difficult because, I have to make my own enjoyment with these concepts and manage my own time and continue going to school. And, sometimes it's easier to fall behind. It's easier to do nothing when you're sitting at home. But now I've had to kind of realize that I have to improve my time management skills throughout this whole pandemic. Of course, yes, definitely. It's that self-discipline concept there. Being able to manage your own time is very different from traditional settings. Okay. Well, thank you very much to Emma and Mike for your comments regarding this distance learning. Yes, of course, I want to echo distance learning has definitely led to our students developing their own time management skills and also their organization skills as well. So that is a new skill that you will have to acquire through this change of instruction. I also want to explain RSD. First of all, I know many of our staff, teachers' aides, teachers are here watching this broadcast. So I want to thank you all for your hard work and dedication working through this process. It was not easy. It was not an immediate shift over as well to this remote learning within 48 hours. It just was not that easy. But your persistence and your commitment and your resiliency to make sure that our students receive the best education possible shone through. And there was a learning curve for all of us, definitely. But really, I am so proud of our leadership team, making sure that all staff had the proper training and support to provide a high quality of education. That is so challenging, especially for our younger kids, our kindergartners, our preschoolers, our grades 1 and 2. Doing this learning through a technological modality is so hard. I'm proud to say that we have had a high number of engagement and participation in learning too. We have had 90% attendance and participation for most weeks, which is far better than most public school statistics. Really, our students, we are so thankful for your patience throughout this process. As we approach 12 weeks now, you'll notice that we've started being able to make these adaptations and getting used to the process. And we are making sure that we are getting the best quality education out to our students. So thank you for that. And also, if you have any questions, please feel free to write those in the chat box. Sam will be posting questions and we can respond to those throughout this Q&A meeting. I'm sure, Harry, are you ready for Q&A time now?
I sure am, but let me just echo your sentiments. I think I've mentioned right in the beginning about, supporting each other, helping each other, and getting through this as a team. And certainly that's why I think RSD is managing all of this in such a way that, it takes the parents, it takes the students, and Mike and Emma, thank you for sharing your stories. And in fact, I bet you every other parent and every other student who's on this call going through the exact same thing. So, it takes great leadership and it takes all of us being part of the team. So thank you. But yeah, let's get into some Q&A. And I think Sam's going to be letting us know what the questions are. We have some ahead of time, I know that, but I'll let Sam jump in if I'm not exactly sure how logistically this is going to go.
I am just going to talk and Hunter or Jim are going to sign for me.
Perfect.
So the first question that we have says that I am very concerned that young children may unknowingly be under a lot of stress from physically being and not being in school and not playing with their friends, and from the images that they're seeing in the media about protests and riots and looting. So what can parents and relatives do to help young children through these difficult times without adding to the stress that they may already have?
Wow, that's a really good question. And I'm not a parent, so it's harder for me to answer this question, but I will share with you. I may not be a parent. I have 11 brothers and sisters. I have 29 nieces and nephews, and I have 36 great nieces and nephews. So that says two things. One, I'm old, and two, I come from a very, very large family. So let me do my best. And fortunately, we had this question ahead of time, so we were able to kind of look and see what the experts are saying about this. And here are some of the tips that we found from the experts, including the family therapist that, and excuse, there's a train going by. So I'm doing a lot of work with behavioral and mental health therapists, and a member of that group is the family therapist here at the University of Rochester, and we're trying to expand those services for our families. But they shared with me some ideas, and so let me share those with you. First, as a parent, step back a little bit. Think about what you want to share with your child. Think about their age and things of that nature, and then even go ahead and practice a little bit. Practice in your head, practice in front of a mirror, but practice what you're going to say and plan it out so that you have a good idea of the message that you want to get across. Then find a quiet moment to have the conversation, and just be real. And according to the experts, we all know parents are human beings too, right? But sometimes parents feel like they have to be bigger than that. And so just being honest with your child, sharing the actual stuff that you want to talk about, whatever fears there are, and then opening that up to let the young child be able to have the conversation with you, and about whatever that difficult situation might be. The concern about not being able to go to school and be with their friends, and and how lonely they might feel. But just reassure them, let them know at the end of the conversation that it's going to be okay. It's going to be okay. These are tough times. We're all scared. We all don't know what the future may bring, but we can be confident that we'll get through this together and we'll help each other, and that whatever the child needs, that you're going to be there for them. And you know what? Those words of advice play out for mom and dad too. So have those conversations with each other as parents as well.
And if I can just add on to that as well, that question really, that covers our coronavirus situation now and the protests as well that are around the country. I think that's very, very accurate. Having those open conversations with your child is so important. It's never too early to have these conversations. And really, you have to be comfortable to have those uncomfortable conversations with children. So I think it's very important to provide that support and assure your child that they will be all right, model appropriate behavior, especially with our deaf and hard of hearing students, where they need a lot of access to communication, modeling and explanation. Our staff as well is providing that, but resources and support on all of these topics can be provided as well.
So Hunter,
when we open these things up, because of our culture, deaf culture in and of itself requires hugging, close proximity, the ability to touch each other, that physical contact. Those are appropriate as deaf individuals. However, now we're going to have to change over a little bit and make sure that safety takes a priority, and we have an important focus on our medical safety and avoiding those kinds of behaviors, because that, even though it comes into conflict with our culture, we need to educate our students, especially our young ones, of these trends. And really, I know this is going to be challenging, but when we open up, having these conversations is so important, I believe.
Hunter, I just want to say thank you. You really brought that together for me. I'm immediately thinking COVID and the statistics that I read off, and how do young people deal with that kind of information. But for you to tie it into Black Lives Matter was really important to me. But then also to tie it in helped me have more sensitivity to the deaf and hard of hearing culture. And, you know, not being part of that culture, but you know, the hugging and the touching and the physical aspect of it, I think it was, thank you. You woke me up a little bit there. So thank you, Hunter.
And I do just want to clarify as the interpreter that was Tony that was making those comments. It wasn't.
I'm sorry. I am sorry. My screen just has you now. So I don't know why that happened. Tony, I apologize.
No, that's quite all right.
All right, I have to, so this is fun. I have to figure out my screen. All I can see is myself and now the interpreters who are bouncing back and forth.
You want to put yourself into gallery view?
Okay, is that what I must have hit a button by mistake or something.
When I put Tony on spotlight, sometimes when I take it off, it goes back to single person.
That's what I must be, single person. Okay. Gotcha.
So I have another question for you guys.
Okay.
And that is, what does funding look like for reentry? Is there any support from the state, including for mental health services for some who have been traumatized through this experience?
So we have done some additional funding. What we have not done a good job. Let's just be honest here. We have not done a good job at addressing the funding issue when it comes to protective gear and you know, mental health services and other types of services. That is still in the works. Let me explain where we're at. We're, you know, the state is in very difficult financial times right now. With the New York pause in place, our sources of revenues, taxes, are woefully behind, both from a timing standpoint as well as the dollar amount coming in. So we're, the governor has postponed making any downward adjustments at the state budget. There was a potential that was going to happen on May 15th. He decided to wait for to see what the federal government is going to do. We're hopeful that the federal government will come up with more assistance for our families in the area of, you know, housing, in the area of education. We would like funding to go directly to schools, and in the areas of mental health and all of the, you know, housing, all of that stuff. So we're working with our representatives at the federal level to the next stimulus package, as they call it, that comes out, that there will be money flowing to the state, to the localities, county, and hopefully getting that help to family members. So I can't give you specifics. I can just tell you that we're working on it, and that help is really going to come through federal assistance.
A follow-up to that is, what are your thoughts about defunding the police and allocating those additional funds for the other services that are not adequately funded?
Yeah, I'm supportive of, when we say defunding the police. I've talked to the advocates about this a little bit. I think we need to come up with a different phrase, because that suggests that we're not going to fund law enforcement at all, and that's not really what they're asking for. Is let's redirect some of the funding that's going to law enforcement and redirect it into community-based services. And I am supportive of that for sure.
Tony has something to add?
Yeah, about the federal funding. My understanding is that yesterday or several days ago, there was a big announcement that they would be supporting the next stimulus package. And it would be very nice if on that, I'm sorry, I'm having some trouble seeing the images so
Receive that
small.
information from Secretary Mnuchin that they would be sending that money maybe to the states or individual Americans, or whether they were going to be fully supporting states' needs as well. So where that funding was going to be allocated to was not entirely clear. However, there was an announcement from Secretary Mnuchin that he was in support of another stimulus bill.
Yeah, so my understanding is that the negotiations are still going on between the House of Representatives and the U.S. Senate. That the House of Representatives has already passed its bill. I don't suspect it's going to be even close to that, but that's a good negotiation start. The debate is not to be political, but this is just where the sides are. So the Senate Republicans and the president are saying, quote unquote, they don't want to bail out the blue states, New York State being a blue state, being a state predominantly of Democrats. But the interesting dynamic here is many states that are politically run by Republicans, their annual budgets are coming up July 1st, and they also need help. So the hope is that through those negotiations, recognizing that every state in the United States needs help from the federal government, that ultimately that's going to be a break in the logjam, if you will, and that there will be a negotiated agreement. My hope is that funds flow to the state, funds flow to localities. So that would be the counties, but it would also be our local school districts when it comes to the education funding. And then I think there's also a package of proposals that would help families again.
Okay, another question. Sam?
How do we prepare ourselves if a second wave does occur of COVID?
Okay. Well, let's start with what are we doing now, right? So we need to remember what I had said earlier about washing your hands often, 20 seconds, 6 feet apart when possible, wearing facial coverings when you're out, monitoring your own health. If you have symptoms of a cold or something like that, then you ought to really make sure that social distancing is adhered to. But as we move forward, we've had the State Department of Health and the federal folks, our county Department of Health, have all said that we need to be concerned about a second wave in the fall. And so we need to think about what we're going to do right now. And that is continuing those safe practices, all right? Get people in the habit of wearing those facial coverings, and that will prevent the spread of the droplets, if you will, that has the virus in it. We got to make sure that we build a supply of personal protective equipment. So remember when this first started, that there wasn't enough facial, we ran out of facial masks really quickly. We ran out of hand sanitizer real quickly. We ran out of sanitizer in general. So we need to be building up those supplies of things right now. And I know we're working on that at the state level. I'm chair of the Assembly's Committee on Aging. And in that capacity, I have asked for a full review of what happened in our nursing homes so that we can take corrective steps to prevent that spread to the extent that it happened in our nursing homes. That would also be the same for other residential facilities. So we need to move forward in that. The last thing I think is really think about what you're doing right now, and then apply that even after, like today we're phase number 3, where so now people will be able to sit in restaurants inside instead of outside. And as we go through these phases, just keep practicing the health safety measures, and that will help us get through it. I was pretty disappointed. I live near Highland Park here in the city, and I was pretty disappointed with the number of people who are not wearing masks and they're not practicing social distancing. And that we're going to have to keep doing this until we have a vaccination. So, once we have a vaccination, then the social distancing stuff may be lightened up a little bit, but that vaccination probably isn't going to come for quite some time now. It takes us a long time to develop a vaccination. And I know we have some of the best minds in the country, and right here, University of Rochester is one of the organizations working on developing a vaccine for COVID-19. But until we have that, we need to practice these safety measures, and that is what's going to keep a lid, if you will, on the extent of or the degree of the second wave, which is predicted to come.
Okay, so with that said,
and to clarify, that started with people having to people that are preparing. I'm sorry, it's just too small. I can't see.
So I think it's important for us to keep our personal safety in mind. It really starts with us, and we need to focus on the safety of others. I wanted to point out the nursing homes. RSD has a dorm program that we run. That's another thing that we need to have our attention on while we're reopening our school, is that dorm program. We did receive new guidelines for nursing homes to help us better prepare ourselves in opening up that dorm program and all of those safety measures that we need to put in place, cleaning processes and so forth. So I did want to share that with you, that we are aware and we want to be focused on improving the safety of our dorm program, and that it isn't just our academic side that we're focusing on, but our residential program as well. Sam?
right, so a question came in about the vaccinations. And do you think, or what's your stand on whether or not it would be required for employees who work in schools or in public service?
My expectation is it will be mandated, and I would support that. It's necessary so that we can keep control over the spread of the virus, and I would be supportive of that. And I think it ultimately will be a mandated vaccination.
Okay, so we are a little bit after 3 o'clock, and we want to respect everybody's time. So one last question, and I'm going to assume it's more towards Tony, and that is, will teachers and staff be provided with clear masks when campus is reopened? And what about for students?
Of course. So that's also part of our reopening process that we're looking into currently. We are currently working with Monroe Public Health to assess what kind of masks are appropriate for our staff and our students. And we're talking about FDA cleared PPE or CDC cleared devices. And we want to make sure that we're focusing on our staff and student safety first. Secondly, we're working on what fits in with our education. We have different perspectives on this, and I think we will probably provide the option of a clear mask as long as those are approved by the CDC or FDA, and also regular masks. If some feel they are uncomfortable with the clear masks, or they fog up or cause other issues, then that is a resource. I also was involved with the Superintendent's Association of Deaf Schools across the country, and we are having that discussion about masking and whether they're using clear or otherwise. There's no clear answer at this point now, but again, it's based on individual preference, but whatever it is, we will provide it. That will be part of our responsibility as a school.
Okay. Any closing messages from either?
Sure, I'll go first, and then we'll let the superintendent close us out if that's okay.
Of course.
So I want to first of all thank RSD for co-hosting and giving me an opportunity to talk to the wonderful parents and students at RSD, as well as some of the teachers who have joined us. You know, I'm a firm believer that you know, communication is so vitally important. That's one of the reasons I introduced the bill that I mentioned earlier, requiring American Sign Language when either the governor or local officials are giving announcements in connection with emergency steps that they're taking. But also every aspect of our lives. We talked about that a little bit when, you know, we were talking about how do you share this information with your children. You know, that's just another form of communication. And right now our communication is being challenged somewhat because we have to talk to each other and communicate with each other vis-a-vis these Zoom meetings, which, you know, like you had said earlier, you know, some of us like to hug a lot, and I'm a hugger as well. And, you know, so this creates some difficulties, but, you know, I just want to thank you all for letting me join you for an hour this Friday afternoon to share some of the stuff that we're doing at the state level. And I welcome anyone to call the number that I gave you, reach out to us via email, and you know, hopefully we can work with each other, support each other, and walk through this and have this journey together. And again, Superintendent, thank you. You're a wonderful leader for RSD, and you're a wonderful partner in public education. So thank you all.
Well, and many thanks to you as well, Harry. So I will close up. I want to thank everyone for participating in this session. Friday afternoon, I know some of you wouldn't want to be involved, but because of you, thank you for having the heart and the commitment to make sure that RSD continues to provide a high quality of education. So I want to thank, firstly, the PSA, Mike Kane, and your board for joining this session today and for your ongoing support for the past 12 weeks. I also would like to thank our teachers, teachers' aides, dorm counselors, United FAC Association, the union, for your continuing work and involvement in this conversation. I would like to thank our students. I know there are a few students joining us today. Thank you for your participation, and thank you, Emma, for your time discussing your experience and your journey from the classroom to the virtual world. So I'd also like to thank my leadership team for your hard work and involvement in this process. I also need to recognize the 4201 School Association, Hinman Straub as well, our lobbyist for the 4201 schools, and for Corning Place Communications for their work in preparing this event this afternoon. And I'd also like to thank my office staff as well, Sam and other individuals, for running this event today. But the biggest thank you is to Harry. Thank you so much for being accessible to all of us and making yourself open for us to communicate with you, and for sharing our ideas, asking questions, and for continuing to make yourself accessible for any questions that we may have in the weeks to come. So thank you very much. Thank you all. Town hall over. Thank you very much.
Thank you.